Hi everyone, my name is Dr. Mohan Seekram. I'm a GP in Merton. I'm also the East Merton locality lead. Okay, so I'm here at the Merton Vaccination Hub, and there's been quite a few patients who've been quite anxious about coming here, so I kind of want to explain the process. So that's the entrance, and I've got Steph here, who's one of the volunteers. Hello.
Good morning.
Steph, tell us what you do when patients come here.
When patients arrive, we welcome them, we double check that they've got an appointment, and then we ask them some screening questions, very simple ones, and then we welcome them into the hub, ask them to go down the corridor to meet our colleagues at the end, who will take the details from them and get them into the vaccinators.
Excellent. Grand job you're doing. Thank you very much.
Thank you.
And they will go to the next sort of point to see our volunteer, Nigel. Tell me what you do when the volunteer comes here.
Okay, hello there, hi. So we are going to take some details. So they're going to come through the main entrance there, come up this corridor, and they will stand 2 meters away from either of us, who will be then taking their details. And we will ask their details and write them down here. All the time we're going to emphasise social spacing, make sure they don't get too close to each other. And then depending how busy we are, we will either send them straight down to the vaccinators down there, or if we're already getting a little bit busy down there, they will go in the waiting room here, where you'll see the seating that's already spaced apart. And they will take with them a white piece of paper that's going to look a little bit like this here, which they hand to the vaccinators, the medics down there, so they can get their details into the computer and get everything logged properly.
Excellent.
And it should be a quick process. Generally it's quick, and it's always safe.
Thank you, Nigel. I'll go and have a look at what's over there now.
Okay,
Thank you. And we're coming to the main bit here, and this is the vaccination room, and there's no one here yet, but I'm going to go and find the doctor. Rafik, I'm just showing patients what happens when they get to this bit here. So Rafik, tell us what happens from here when the patient comes and sees you.
Sure, so they've got a little piece of paper, I take it off them, we check that they are who they are, and then I check, most importantly, that it's absolutely safe to give the vaccine. So we have a set of questions, takes about 2 minutes of a conversation, and then I can answer any questions you have, which often there are, and then once we've gone through all of that, we'll check it's okay to go ahead. The jab takes about 2 seconds, and it's really not at all painful. I've had one person moan at me yet, and then once you've had the jab, I give you a 15-minute time if it's the Pfizer vaccine, or if you're driving home, for example, you've got to hang around for 15 minutes. And then we send you over there to be guided by a volunteer to a seat where you can wait socially distanced for another 15 minutes. And it's really very, very quick and simple.
Excellent. So we're going to work our way down to the observation bay, but that sounds very simple. Thank you. So from here, we then walk over here. This is the observation bay, just here. And these are where the patients stay for about 15 minutes. And they go through here to the exit. And that's the end. And that's the journey through the hub. Not too bad, is it?